The death toll is growing exponentially after a powerful earthquake hit western Haiti Saturday morning.
Haiti declared a state of emergency on Wednesday, hours after the brazen assassination of the Caribbean nation's president.
It comes as the nation struggles with severe political turmoil, gang violence, food shortages, and a cholera outbreak.
We were there and they were having a big health fair. It was thousands of people waiting to be seen.
As you walk in the slums trying to see if anybody's left out. And I realized there were those two boys on the dirt and like in the shack. Even the door was made of the portable bathrooms. That was the door of the house.
They looked unkept. They didn't look clean. I thought we saw they had like little blisters on their arms.
When the doctor came over and Corinne came over and they were able to communicate with the kid, I believe we found out that one of the reasons that they looked so sick is they were malnourished, but also they had very active HIV.
And I asked, what is the family? They said, the mother passed away. She was a sex worker, which was HIV positive.
And that's when the next day they actually went to the village and looked for them. And when they got to the house, they were very sick.
But there may have even been some shunning of the community because HIV has such a stigma. I originally thought we were just going to help place them with other family members. We didn't realize they didn't have any other family members at the time. And that's when the Haiti team stepped up to intervene.
And I'm like, wow, we need to do something about it. It was really heartbreaking. Those kids, I mean, they had basically, like I said, we could see the malnutrition. And also they had a lot of blisters in their body. And they could not even walk. They were very weak. We had to carry them. So the condition was very bad. We need to take those boys and let's get them tested. Let's get them to the hospital. Whatever can be done to save their lives, I'm going to give it a try.
If they wouldn't have got there at that time, those babies would not be with us today.
Us four were on call 24/7. So anything that they needed for those boys, they will call us and we'll be there. After release of the hospital, we will have to find a home for them because we cannot bring them back where they were before.
They didn't have family that they could go to. There weren't friends that they could go to. They couldn't come to the US. What do we need to do medically to get these kids healthy again?
But it was really Corinne and team that were trying to get their health together, trying to find them a home.
The stigmatization, the malnutrition that they have, they are homeless and their health were at the worst condition. And it was very tough for us.
They were still trying to find, whether or not there was a place for them to stay and, what their future would be like. They went and got a container, like a shipping container, and set it up as their own little house adjacent to the clinic so that they had somewhere to stay.
I remember that was Christmas Eve. And Fedson, the older one, got back to the hospital because of the relapse of the TB. And the doctor said that he's not going to make it. And they called me at home. It was about 5 in the afternoon. And I said, it's okay, I'll come. Because let me come and give him his last hug because the doctor already told us it was too late. That's about 4 weeks after we picked them up 3 weeks to 4 weeks. And I'm like, we didn't think they bring him on time, so he's not going to make it. And when I got to the hospital and I saw him, and automatically when I saw him, it's just like he was just laying down and then he sat down and he just held my hand tight and hold me and say, Mommy, you came to see me. Thank you, thank you, thank you. And since then, he stole my heart. And I said to myself, I'll do everything I can do until their last breath to make sure those kids can be safe. And we look for another caregiver. We have to find somebody. Finally, we find one of us that has his wife and 2 young girls, and they were willing to take them. So it's been now 7 years since he's been with that family. They like family, because sisters, brothers, and they call her mom. They call me mom, so they've been like a family to us since then.
We had them try on pants, we had them try on shorts and everything, and we bought them all their school clothes.
I don't think most people can comprehend the difficulties of what they do in Haiti on a daily basis, because it's one of those things where unless you see it, you really can't understand it. And then when you layer on top of that how they were willing to go above and beyond outside of their work performance to just do something good for these kids that needed it. The first time I saw them when they looked healthy, it literally took the wind out of my lungs. And I remember I just started crying because it's hard to understand the situation that they were in unless you can kind of have the before and after comparison. But they didn't even look like the same children. Knowing that they're in a safe place, knowing that they have people who care about them, knowing that they're going to school, knowing that they have a future, all of that.
The best part is when Corinne would send pictures of them going to school with their white shirt on, their backpack. You know, you had these boys that had, lost their family, had were sick but doing well now. But they were so affectionate. And I think that's what still just warms my heart, how affectionate they were.
The fact that they're safe, they're healthy, they're, they have a future, that's just priceless to me.
Those kids get tested and they didn't think they were gonna make it, and now they're all undetectable. So this is something I want people to take from that story in regards to early intervention is the best.
And not just the initial part, but ongoing. Checking on them, finding them family, going to get food, whatever we sent, it could have been sitting somewhere, but they utilized it. Even to the fact that sending us pictures, keeping us abreast that they're in school now, letting us know, we got their birth certificate so we can now enroll them in school. If not for them and AHF, we wouldn't be having this conversation.
I will tell them that how much I'm so proud of them, how they were so strong, and the journey wasn't easy, but they make it through. So I want them to really believe in themselves and know not to think about the past, and they can be anything in this life.